short-term must-dos. Changing priorities.
Within our community.
Within West Kent, a clear thing, working an whole system approach. You know.
Today's about starting a new conversation. Today's about bringing all of the leaders across Kent and Medway together to start talking about how we do things differently.
We've got a cross-section of people from the voluntary and community sector. We've got people from district authorities and local authorities. We've got the police, we've got the fire service, and we've got the NHS across primary, community and secondary care. So a very wide range and very diverse.
Key thing for me is the discussions. The room's vibrant, people are engaging. These are the times when those real relationships get built and further enforced. I've sat and listened and I've heard one common theme. People do want to work together. They do want to get to the end point, which is to do things better for our population. And hopefully out of today, this is where we're going to arrive.
Because alongside the integrated care strategy being developed,
Somebody's doing the work, engagement, that's not something that's...
It's going to take time. We're committed to putting in the work to engage differently with people, to listen differently to people, and keep on talking to people about what we want to do.
The aim is absolutely to ensure that this is enriched and strengthened by proper public engagement.
It's not going to be easy because things would have been fixed had that been the case. But I think if people can see who it is that they can engage with, what it is that they can do in order to work collaboratively, then I think they'll start to feel a little bit more confident in working at a system level, because it's a big elephant. And, you know, Kent and Medway, massive population, nearly 2 million people. But actually we're not interested in 2 million people. What we're trying to do is to work so that every individual gets their needs met.
People in more deprived communities, and that creating that sense of trust to sort of share information about themselves and their experience, and how we kind of create that culture.
And that comes back to how we need to reach into our more disconnected communities, our more disadvantaged areas, so that they understand that things have changed, and I think that's the journey for us today.
I really hope that what people will take away is a licence to do things differently, a licence to recognise that we need to put the citizen in the middle of what we do, and then they'll go back into organisations and work out how to do that, and they will also form relationships with people they meet today that will enable them to do that more effectively.
For us, for Kent Association for the Blind, we work closely with employers around environmental.
Start with the mum in particular and work out from there.
There's a little thing there about the built environment and the health impacts of that.
But then you immediately almost push it by saying, so how are we going to measure it? How are we going to count it?
It needs the motivation of everybody to work together. It's good to see the councils and the NHS there. It always worries me that everybody refers to it as the NHS. It's not. It's all about everybody's health. And that's what we need to focus on for the future.
We'll have to take individuals with us, and that means the people who live in the communities, they'll have to come along with this process as well. So it's not just the people in the room, but I think the people in the room really were the right people in the room, yeah.
It would be really much more simple if there was an integrated health and social care system, so that people had sort of one point of contact and a much more straightforward pathway to accessing the services that they need.
It's about go back into Kent Police today, talk about some of the partnerships and some of the relationships that we'll be able to build from here. Because everyone's trying to move in the same direction, and rather, as was described to me today, rather than going in parallel lines to achieve the same objective, we can actually work together to move some of those things forward really, really well.
It's been a brilliant day just to engage with kind of everyone across the ICS really, see different stakeholders. We're all trying to do the same thing, so I just think it's great that we get in the room and think about how do we do it together.
Towards the end of the day, in those conversations, people were more energised and optimistic, I think, than when they walked in.
We've made lots of really good personal connections today, and we heard a lot about trust, didn't we? So we've now got people whose faces we know, who we have we've built that trust, and we can have those conversations on behalf of our organisations to say, okay, how can we now do it differently and better?